Hey, Dr. John from LSU Health, by the way. Welcome back to Kiel. So, the drive-through at the Fairgrounds, where are we? Do we have more vaccine in hand, or at least the medical school for distribution? Fill us in.
We have vaccine on hand for about 1,000 a day for the next few days. So we have, I've been all weekend scheduling the people who were pre-registered in the order that they were pre-registered so that everybody maintains their place in line. And we are ready for those folks to start showing up today. They should have received an email from me, and those few who didn't get an email from me because it got rejected by their email server, we're going to be calling them this morning to let them know.
Just to clarify, open this morning, Fairgrounds, 8 until 3, 8 until 4 today.
And people are scheduled in 2-hour blocks, and they've already received that scheduling, so they know when to come.
Okay, and your plan is to be open today and tomorrow. What about beyond that?
Yes, beyond that, and people have already been scheduled beyond that. Further details to come.
Okay, so definitely today and tomorrow, but the extension
Wednesday and Thursday.
And Wednesday and Thursday.
Yep.
Okay. How are we for vaccines? I know Christus Health has brought in some of theirs. Are you guys getting some more? How many do you have on hand?
We have a commitment up to 4,000, so 1,000 a day for the next 4 days. And
are you still there?
Yeah, I'm here.
Okay.
Thanks.
Okay. If you would repeat your answer because your phone clipped.
Yeah, we have enough for 1,000 a day for the next 4 days.
Okay, and then after that, you're hopeful that you'll get more in hand, correct?
Correct.
How many do you still have to get to? How many are pre-registered already?
So on our pre-registration, we have another. Sorry, hold on. Of the 70 and older, there are about 2,000 more pre-registered. So we got 6,281 pre-registered. And we'll be able to take care of at least 4,000 of those in the next 4 days.
Now, just to clarify, we are once again talking folks who are over the age of 70, correct?
That is correct.
And how many of those do you have pre-registered that you may not? What's the total number? Are you going to be able to get to everybody that you had registered the next few days?
We will not get through everybody in the next few days. And we've petitioned the state for more vaccine to start, next week again, and we've got about, like I said, we have almost 6,200, a little over 6,200 people registered who over 70 who want the vaccine, and we'll be able to take care of about 4,000 of those in the next 4 days.
When do we move to the next group, teachers and other groups that are awaiting?
Right.
And what is the next tier?
Well, the next tier and the timing of the next tier is all determined by the governor's office. So there are a lot of different strategies, but that we will find out when the governor determines. The important thing to note is that, the priority has been to vaccinate over 70s because we know they are the highest risk of bad outcomes. And so this is about saving lives. It's not about anything, nefarious or other things. But the important thing is that we've only vaccinated, as best we can estimate, about 20 to 25% of the over 70 population so far. So we've still got a good ways to go with that population, and that's why we're making the push this week and hopefully next if we have more vaccine.
It looks like the state is going to get about 58,000 doses a week. Mm-hmm. That's what the governor is saying. That's going to leave us short in a lot of parts of our state, correct?
Well, it is not going to meet the demand, and a lot of folks are very anxious to get vaccine as quickly as they can, and I definitely understand that. And support that, it's a supply issue above the state level, and so there are areas of the state that have not as much coverage as we've had already in our area. So we've been very blessed actually with the amount of vaccine we've been able to move out through our work and hospitals and clinics in the area and pharmacies as well.
Doc, wrapping up on a brighter note, I saw a story this weekend that in Israel, that for COVID patients over the age of 60, now they've been distributing the vaccine there, that their hospitalizations for over 60s have fallen by 60%. I don't know if you saw that or not, but if you did, it must make you kind of giddy, right?
Yeah, that's phenomenal, sort of the real world experience, right? We said that the clinical trials were a home run, hitting that 95 to or so effectiveness rate. But now when we implement it in the real world, we're seeing really, really good outcomes. And the other thing about that Israel work is that, that's a country that's already been able to get 25% of its population vaccinated. So that's a real, we're nowhere close to that. We're around 6-7% nationwide vaccinated so far. So we've got a good ways to go in terms of getting vaccine out. And but yes, that real world experience is invaluable and definitely gives us a bright light to look forward to.